Before 2021, the disease mucormycosis, commonly known as black fungus, was rare. Even in January of 2021, there were only 8 cases around the world. Also, India reported only 1 case on the 8th of May in 2021. But the count has gradually increased now that there are 9,250 plus cases and over 219 death counts due to black fungus. These counts are only based on the states like Maharashtra, Gujarat, Madhya Pradesh, Haryana, Delhi, Uttar Pradesh, Bihar, Chhattisgarh, Karnataka, and Telangana. Hence, by considering the count in respect to these places, it is quite a vast number. It is found that the disease is actively hitting people through inhalation, food, and skin injuries. When the spores pass in a human body through inhalation, or food, or skin injuries, it affects the lungs, or stomach, or the skin, respectively. In serious cases, the disease also affects the brain with a higher percentage of mortality. It is found that the disease is originating from places like dusty areas, cow dung, decaying organic matter, and rotten vegetables. That's why it's essential to maintain our surroundings and keep them clean and hygienic. The disease comes with symptoms like headaches, nasal patches inside the nose, one side of the face swelling, and vomiting and bleeding. So, if you encounter any of the mentioned symptoms, it's wise to reach out to the doctor immediately. The disease can be diagnosed through blood tests in the early stages and through CAT scans on a severe case. The treatment for this disease includes amphotericin B, posaconazole for the antifungal property, and the vaccine rate of 3,500 a dose. Also, the treatment consists of operating and removing the affected parts. The disease was named black fungus after its capability to turn the blood black when the blood vessel stops functioning. A keen observation has been done on understanding the reason behind the sudden rise of black fungus cases, and the results showed that 75% of fungal cases are due to steroid consumption. It's found that the disease is affecting people with diabetes, cancer, HIV, organ transplants, and low immunity. In India, the mortality rates are dependent on the place where the person is getting affected. An average mortality rate is 54%, while if the affected place is the lungs, the mortality rate increases to 76%. For the brain, the mortality rate gets increased to 96%. Though black fungus is prone to affect many people, it is prone to majorly affect people recovered from COVID. This is because when the oxygen level of the COVID patients falls under 93%, they're given steroids. But in many cases, steroids are also prescribed even before the oxygen level drops. Hence, this overuse of steroids has become the reason for black fungus to attack many COVID-recovered people. This black fungus can be prevented by wearing masks properly, avoiding unhygienic places, eating healthy meals, avoiding overuse of steroids, usage of a clean humidifier, avoiding red meat, and including more garlic in everyday food. A proper intake of healthy food includes eating things like yogurt, cabbage, buttermilk, paneer, soybeans, idlis, and green peas. These will also help in protecting against the black fungus. Apart from black fungus, there are also different variants like white and yellow fungus. Among that, white fungus comes with a higher mortality rate. So, by understanding the reasons and situations of this black fungus, it's clear that it's important to have personal hygiene and maintain the cleanliness of your surroundings.